Hi, my name is Madison. I'm a student nurse at the University of South Alabama. This is going to be my urinary catheter check off. Here's my room scan, my pillow stand, and then that's all the stuff from my coffee table. And then there's my setup right there. Okay. Alright. So we would walk into our room and we would check the orders for the correct order, insert and maintain indwelling urinary catheter, and place on nurse-driven protocol to remove catheter when indications are no longer present. Okay, and we would also verify our patient using two forms of verification: Jaguar Jones, 82563, 82563, room 240, 2040, room 2040. Okay, and then some reasons that we would place a catheter would be if they have an unstable pelvic or spinal fractures, it's end of life care, they have acute worsening mental status, or there's a required immobilization after a surgery. So then we would perform our hand hygiene, place the patient into working height, lower the side rails, place the patient into dorsal recumbent, and then raise their legs. Then we would spread their legs apart, giving us ample working space, and we perform perinatal care. So we would use warm soap and water, and for a female, you would do the outer, each swipe, you would use a new washcloth, or new part of the washcloth. You would do the outer labia majora, then the inner labia majora, then you do the outer minora, then the inner minora, and then you do once down the center. And then for a male, you would start at the urethral meatus, going in a circular motion down the glans penis, then you would get a new one, down the shaft, and then you get a new one, and then you would wipe the scrotum as well. And if they had foreskin, you would pull it back and go from the meatus once down the glans penis as well, and replace it after the procedure. So after that, you would remove your clean gloves, and the patient's already positioned and everything, so then you would get your catheter kit, pull it out, and you would fold the bag over the trash can, placing it at the patient's hip. So then we would open up and then we would place our sterile gloves on. Okay, and you would ensure a nice fit. Then you would get your drape, ensuring only to touch that border. You would then place the drape down in between the patient's legs, ensuring not to contaminate yourself. Then you would place your tray closer to your urethral opening. You would open up your iodine swabs. You would open up your lubricant, placing it down in the tray. Then you would take your catheter. And you take your water-filled syringe and attach it to the port. Okay. And then you would remove the outer plastic coating, and you would place the catheter into the lubrication 2 to 3 inches for a female and 5 to 8 inches for a male. And while that is in the lubrication, you would use your non-dominant hand to open the labia. You would do one swipe down the outer labia, one swipe down the inner labia. You do one swipe down the outer labia with one swab. Then you would do one swipe down the inner labia with another swab. And then you would do one swipe down the center. And then you would grab your catheter and instruct the patient that you're about to insert the catheter and that they can bear down, or they can take a deep breath and exhale upon insertion. And you would insert until you hit urine, and then you would still go another inch or two further. Then you would hold the catheter in place with your non-sterile hand, and then you would plunge down on your water to inflate the balloon. Keeping pressure on the plunger the entire time. Then you would pull back slightly to ensure, and then you would scoot it forward just a touch to take the pressure off of the bladder wall. Then you would get your stat lock. Okay, it's gonna fall out. So you get your stat lock, open your stat lock, get an alcohol swab, open the alcohol swab, and then you would clean the upper thigh of the patient. And then you would apply the stat lock to the upper thigh of the patient, but not before attaching, oh, that's the wrong way, but not before attaching it to the bifurcation. And you would place, oh, oops, that's backwards. Okay, not before attaching it to the bifurcation, placing the arrow towards the thigh, and then you would place that on the thigh where you just cleaned. Then you would place the bag below the bladder, not on the side rail, but at the bottom of the bed. So we can attach that right there. And then you would take this and attach it to the patient bed. And you would ensure that there were no loops. So I'm going to set that underneath because it has a tendency of falling out. And now I'm going to show you how to take a sample. Well, I guess we'll do this one first. Okay, so you would use this. You would take a sample at the port after 24 hours. So you would unclip from the bed. You would cinch and then you would place that over. It's about to fall out. Just so it doesn't. Okay, so you'd cinch that and let urine gather right there. It'd be easier if I actually heard that thing to get it to actually hold still. But so then after you cinch it, you would get an alcohol swab, and then you would throw that away, wipe the port, and then you would get a 10 ml syringe. Or lock it on. Withdraw your urine. Soft. And then you would insert it into your cup. Ensuring not to touch the rim. Then you would label on this jar, not the lid, always on the jar. And then you would remove the clamp from the catheter, straightening it out to ensure proper flow once more. And then reclamp it to the bed. Okay, so now I'm gonna take you down to the bag. Okay, so we would have our bag clamped on the bed. Just clamping it right here. And we would have a towel set up below the bag with our graduated cylinder there as well. And then grab your container. Holding it over the graduated cylinder, remove the spout, ensuring not to contaminate or touch the lid. Then you would open up, let it flow out, and then after you collected your sample, you would lock it back into place, clicking it back into the correct position on the bag. Close your lid. And then once again, you would label the side of the jar, not the lid. Okay. Put it back over here. Okay. So then, I'm just going to set it kind of right there for now. So after you've done your samples and everything, you would clean up your area. Reposition the patient. So clean my area, reposition the patient, ensure that they were comfortable. Properly dispose of my gloves. And then we would perform hand hygiene. And then we would document. We would document the daily care of the catheter. We would document the size of the catheter. We would document the plan for removal. Then we would document what type of specimen we collected, the size, or well, the amount, the color, consistency, and which method we used to obtain the specimen. So then for catheter removal, we would have, let's use that one again, we'd have our waterproof cloth. And then we would come back. Okay, so we would come back, wash our hands, don clean gloves. And before we did this procedure, we would once again ensure that we had the right patient using 2 identifiers and double checking the chart for the order and ensuring that it was the right time to remove the catheter, and then also double checking our allergies and indicators as well. So first things first is we would start with the catheter bag, once again with the layout with the towel, with our graduated cylinder sitting there. We would drain the bag into the graduated cylinder for measurement, and then we would have our waterproof drape down here, and we have our 10 ml syringe and an alcohol wipe. So we'd have our 10 ml syringe and our alcohol wipe, and we would take catheter out with our alcohol wipe, and we'd clean port. Ensuring that it didn't touch anything. Then we would prime, drawing it back up. And we would attach it and let it, we would draw it to 0.5 of an ml, and then we would let it, we would let gravity withdraw the water from the bag, or from the balloon. So after the water has withdrawn, then we would unattach our syringe, dispose of it in our bag, which fell off the table, but we dispose of it in our bag, and then we would carefully remove our catheter, and then wrapping it up, removing it from the bed and disposing of it. And then we would also use an alcohol wipe to remove the stat lock as well. And then we would perform perineal care with warm soap and water, once again, going from the majora outside to the inside majora, then the outside minora, then the inside minora, and then once down the center. And then we would remove our gloves, and then we would document that as well. We would document how the patient handled the procedure. Was there any grimacing? Did the patient state any complaints? We would document how much water was withdrawn from the balloon. We would document the amount, type, color, consistency, once again, of the urine from the graduated cylinder. And we would document also for the catheter tip if it was intact as well. Then we would ensure, once again, that the patient was lowered back down, the side rails were back up, and the patient was in a comfortable position as well. That concludes my urinary catheter checkoff, and I hope you liked it.